right, let's get started. Welcome everybody and happy Menstrual Health Day. Thank you so much for attending what is going to be a dynamic, productive, and important discussion on taking a life course approach to addressing period poverty and menstrual health and justice in order to elevate the next generation of women leaders. I'm thrilled to see over 200 attendees today from all over the world here with us. This week has been an eventful one for our movement with World Health Assembly and now with Menstrual Health Day. And so we're all very appreciative that you've taken the time out of your busy schedules to mobilize around this issue that in some way, shape, or form affects all of us. My name is Kavita Singh, and I'm the Executive Director of Girls Health Ed. I'm extremely honored to be moderating this discussion and to be co-hosting this event alongside pandemic periods. Today's discussion has multiple interrelated goals. We're here to emphasize the relationship between access to menstrual education and the women's leadership pipeline. We'll be exploring the intersectional challenges experienced by those seeking reproductive health education or information about period poverty in the context of the COVID-19 pandemic. We will advocate for gender transformative workplaces that meet the needs of people who menstruate so that they can fully participate in the workforce, and for funding for programs and research that address what we've learned from the impact of the pandemic on period poverty. We will talk about the role that stigma plays in menstrual health management and period poverty and how to combat that stigma. Most importantly, we'll be creating a safe space in which we can bring together our unique voices and experiences to discuss how to enable access to information and education in order to support people who menstruate to manage their periods with dignity. We have with us today a diverse, talented, and passionate group of panelists and speakers who will be talking about all of the above topics. As I don't want to take too much time away from what our speakers have to offer, I just want to briefly mention some logistics for this event. First of all, we would love for this discussion to be as interactive as possible. We'll have some time later dedicated to audience questions for which you can use the chat function. But in the meantime, we do encourage you to use the chat function to respond to any of the points our speakers make and to share any resources that you feel are relevant. And I will be monitoring the chat closely throughout the event to highlight anything that's particularly pertinent. You should also feel free to live tweet or post anything that stands out to you on your social media. And please be sure to tag Pandemic Periods, Girls Health Ed, and MH Day 28 May. And I will put all this in the chat in just a few moments. And we'll be using the hashtags capital M, capital H, capital D, AY 2021. So that's MH Day 2021. Hashtag Act for Equal, hashtag WHA 74, and hashtag CSE number 4, gender equality. So that's CSE for gender equality. And as I mentioned, I'll be putting all of these hashtags in the chat in just a few moments. Finally, this event is being recorded, so we'll be sure to send you all the recording along with the panelists' bios after the event. So with that, it is now my immense pleasure to introduce to you our keynote speaker, who will be discussing period poverty in the wider context of gender equality, my esteemed colleague, mentor, and friend, Dr. Flavia Bustreo. Dr. Flavia Bustreo is a leading physician, public health professional, and advocate for the health and human rights of women, children, and adolescents, and the elderly, and is known for taking action on the social and environmental determinants of health, including the impact of climate change. She is currently the vice chair of Fundación Botnar, the co-chair of the Lancet Commission on Gender-Based Violence and Maltreatment of Young People, and the chair of the Governance and Nomination Committee at the Partnership for Maternal, Newborn, and Child Health. Dr. Bustreo is a member of several boards, including the UN University's International Institute for Global Health, and she advises several governmental and non-governmental entities, including the Global Future Council on Health and Healthcare of the World Economic Forum. Dr. Bustreo was the former Assistant Director General for Family, Women, and Children's Health for the World Health Organization from 2010 to 2017, and also served as co-chair of the board of Gavi, the Vaccine Alliance, from 2015 to 2017. At WHO, she led the organization's work in reproductive, maternal, child, and adolescent health, climate change, aging, vaccinations, health and human rights, health and gender equity, and the social determinants of health. Previously, Dr. Bustreo was the executive director of the Partnership for Maternal, Newborn, and Child Health, served in a variety of roles at WHO, UNICEF, and World Bank, and was the interim deputy director of the Child Survival Partnership and special advisor to the Prime Minister of Norway, helping shape the government's $1 billion contribution to infant and child health. Dr. Flavia, over to you.
Thank you so much, Pavita, for that very generous introduction that serves to remind me and let everybody understand that I'm just quite advanced with age. That is like when you have that opportunity to have contributed as you have highlighted. But let me first say, Pavita, how delighted and thrilled I am that I am here with you, with girls' education, with the pandemic poverty, and how thankful I am that you and the group are raising these issues today on Menstrual Health Day. And I want to say you can always count on me, on my voice and leveraging that, you know that. But I can see that every time I collaborate with you, I can see there is more energy and more people, and this is fantastic, really. Thank you, and thank you, Jennifer. I'm also especially delighted that I know we have Chandra Muli, a dear colleague and friends from the World Health Organization days, and I'm thankful that also the World Health Organization is looking at menstrual health with new eyes, and this is really exciting. So just my role today is really to try and position period poverty within the domain of gender inequality, and try to ensure that when we come with requests and we advocate, that we see the big pictures and the big policy implications that our requests have. Because it is not, I should say that not to be cynical, but it's not to surprise that a basic needs and a basic necessity that particularly young girls and women have is not given appropriate attention and adequate investments. This is a part of a pattern that we have seen that also prevents and deters women, for example, from having access to education, from having access to professional employment, and I would say also to retaining professional employment. And the pandemic that we are currently living in, that is justifying how we are meeting today through this media that thank God can still enable us to talk and to work with each other. It's a stark reminder of this, Pavita, because when we look at the inequities that the COVID-19 has highlighted, we see a dangerous pattern, for example, of the workforce that has lost their job during the pandemic. In the majority of the countries, including my own Italy, 90% of the people who have lost their job are women. And we see that this also, one other aspect that the pandemic has really truly highlighted. Even this week at the World Health Assembly, we are discussing the pandemic response, but nobody has touched and discussed what we call the pandemic within the pandemic, or the shadow pandemic, which is the violence that has been exacerbated during the pandemic and the lockdown, and how for many young women and girls and children, these months of lockdown has meant to be living with the perpetrator of violence without assistance and support for mental health, without knowing who to ask for. So when we talk about period poverty, we should have a view of it within the request that we're making to elevate the request and the rights that girls and women have in the world. And as you said, I have always been very passionate about using the rights arguments. And I want to begin by saying that when we talk about menstrual health, there are several human rights that are undermined by period poverty. And that, for me, foremost, is the right to human dignity. It's the right to an adequate standard of health and well-being. And of course, I alluded to the right to education, because in many parts of the world, when a girl menstruates, she is prevented or she is self-excluding from education. Of course, the right to work, because if you are a worker and you don't have the necessary way to really have menstrual hygiene, you cannot really work productively. And also, this touches about the right to non-discrimination and gender equality. Because let's face it, and I know here we'll hear from many other voices, it's discrimination against women that are menstruating has a long history, is associated to cultures, is associated to social stigma, is associated to taboo. In many parts of the world, women that are menstruating are not to be touched, are not to be having relationship, sexual relationship and intercourse with, and that has remained and persist into the fact that, for example, the very simple availability of menstrual hygiene and menstrual tools is not ever raised to the priority that it needs to have, and is not, for example, identified as essential services in the package, and is not being seen during the pandemic as something that we really have to put our effort on. So for me, when we talk about menstrual health, it's important that we look at this broad context in which we situate in our own societies, in our own communities, and we look at, yes, of course, availing the products, availing the necessary products, but also combating that approach and that culture that stigmatizes and makes, for example, difficult to talk about menstruation in many cultures, and makes it difficult to raise the issue. So kudos to all of you that have spoken up on the Twitters, on the socials, because that, in my view, is also a part of how we change this culture, how we change this modality of thinking. So one second thing that I would like to highlight is when we talk about menstrual hygiene and period poverty, Pavita, we also need to recognize that this is a phenomenon that is, I would call it cross-sectoral. We need to have different sectors that are engaged in our quest. So this is not just the health sector that has to be informed, aware, and able to help, but we need clearly the water and the sanitation sector very engaged, because you cannot have menstrual hygiene if you don't have simple water availability. And also we need to have the education sectors, because this issue has to be discussed openly, without stigma, without taboo at the school. And the work that you do and your organization, Girls Education, is so important to demystify and to talk without any taboo about the issues. So anytime, in my experience or policy experience, that we deal with a cross-sectoral issue, we need to reach out to the policymakers of the different sectors, and even to the higher level of the government, because otherwise the response is not cohesive. So in our quest, we need to target policymakers that belong to the different sectors and try to bring them together, try to reach them, and try to advance with them. And then the final comments that I like to make, and then I'm really excited to hear to the younger voices and the younger leaders that are coming to this, is we need to have this basic fact of life for billions that has demonstrated the critical importance of sanitation, hygiene, and adequate access to clean water. we need to have this as a priority within the discussion for achieving gender equality. That is what we need to place, Pavita, together with a group that is here, together with our friends and colleagues in the WHO, in UN Women. There is a large group that is really having a quest of the UN Generation Equality Forum. So these requests that we will be discussing today, let's please jointly together, let's place them in this discussion of the gender equality. And I think through that way of acting with each other, we can see a significant difference and make menstrual hygiene a real priority. Thank you so much. And I look forward to the exchange and the conversation today, including the tweets.
Thank you so much, Dr. Flavia, for your brilliant and ever insightful remarks, as always. So with that, I'd like to now introduce the brains behind this event and my co-organizer, Dr. Jennifer Martin, who is the founder of Pandemic Periods. Jenny will be talking about period poverty in pandemics. Jenny?
Thank you so much, Pavita, and what a joy it is to work with you and Girls Health team. And thank you, Dr. Flavia, for your comments. Now, before I start to dive into this, I think it's really important that we reflect briefly on Menstrual Hygiene Day. This movement emerged from the Global South, with Kenya and Nepal leading the way. And now we're here discussing these challenges related to period poverty and menstrual health. So I want to thank all of our allies in all these regions for catalysing action around the right to health, and the right to menstrual health. A world without period poverty and stigma is possible, and if we want to achieve many of the Sustainable Development Goals by the 2030 period, we cannot forget about menstrual health during this pandemic. It's time for action. So we know that due to COVID-19, the world has seen the first increase in global poverty since 1998. The World Bank has suggested that as many as 150 million individuals will be pushed into extreme poverty by the end of 2021. This situation is only going to further exacerbate the social determinants that lead to menstrual health, poor menstrual health and period poverty. So when household incomes are constrained, luxury items, a lot of people would consider menstrual products to be luxury items, are deprioritized. Now, we also understand that several terms are used interchangeably when we're talking about period poverty, menstrual health, menstrual hygiene management. And the reason we're using the term period poverty today, and we're using that ActionAid definition, which is access to period products, safe hygienic spaces in which to use them, and rights to manage menstruation free of stigma and shame, the absence of this being period poverty. My colleague, Dr. Chandra from WHO, is going to be presenting his latest publication on menstrual health and the importance of having that menstrual health definition later in the programme today. So we're looking forward to welcoming him after the panel. But the COVID-19 pandemic has impacted the lives of millions of people around the world, tested our health systems, and exacerbated these structural and social inequalities faced by vulnerable populations. And I think it's important here to say that we do appreciate that not all individuals that menstruate are women, and not all women menstruate, but we want to recognise that women and girls are disproportionately impacted by pandemics. Our allies at Women in Global Health have highlighted that the pandemic has exposed deep inequalities, including gender inequality, and that they explored this during their COVID 50-50 campaign last year. Many lives are going to be lost because of these fundamental inequalities that COVID-19 is going to exacerbate, and this is going to weaken our response as a society as a whole. So just to kind of put things into the context of COVID-19 and menstrual health, national lockdowns and the restrictions are going to reinforce gender norms and stereotypes, and women are often facing a double burden of having to care for dependables, and also potentially in some settings undertake some still income generating activities. They're at a greater risk of experiencing gender-based violence, particularly during lockdowns, as Dr. Flavia has already touched upon. In my native Scotland, during our first lockdown, we saw a 22.7% increase in the reports of gender-based violence to Police Scotland. Now that's only the reports, those that actually reported it to the police. We're also seeing that there is going to be higher school dropouts, higher increased rates of child marriage, and women are more likely to have to do unpaid and underpaid work. They also tend to suffer from lack of essential services like sexual reproductive health, including abortion care. And that includes, being able to not being able to access products from vendors because of lockdown, because they are restricted, because they are isolated, and they're at greater risk of experiencing period poverty because of that. So families who are restricted to households in some countries also means that women and girls can't change their reusable products or change their pads discreetly. They can't wash them, they can't dry them without their male counterparts or individuals that don't menstruate from seeing that, and that's causing an issue. So I think it's also very important to say here that 70% of the global health workforce are women. 90% of the nurses worldwide are women, yet personal protective equipment is designed for men. Now, without access to facilities, products, even time, and without having been able to, in the middle of a global health crisis, with a global shortage of personal protective equipment, having PPE that's not designed and having to waste PPE or potentially seen as being wasting PPE because you have to manage your menstrual health in the workplace, it is exacerbating this period poverty. Now, Plan International also surveyed health professionals across 30 countries and found that 73% said they had restricted access to products because of shortages, also because of time and ability to manage their periods. So what I'm trying to say here is we run the risk of leaving girls and women behind if we do not address menstrual health during this pandemic, and we need to ensure that they're able to adequately contribute within education, within the workforce, so we preserve this leadership pipeline. Women and girls need menstrual health so they can grow into our future leaders. And today, Dr. Ian Askew, Director of the Sexual Reproductive Health team at the WHO, highlighted that there are challenges faced by menstrual health in emergencies, and he stated the WHO is committed to promoting menstrual health, especially in crisis. Now, although we are starting to see these global discussions, progress is still slow. And during the 74th World Health Assembly this week, the theme was ending the pandemic, preventing the next, building together a healthier, safer and fairer world. And the focus of most of the member states was on universal health coverage. Now, another stats from my friends at Women in Global Health, they did an analysis that 26% of the representatives at WHA were women, only 26%. So how can we get funding, programming for menstrual health if we don't have equitable representation at decision making? How do we ensure that we can provide health for all without menstrual health? How can we get unity as a community, as a movement? We need civil society, we need government, we need multi-sectoral partnerships, we need innovation, research and community involvement that is not tokenistic. We need scalable solutions that respond to context and culture and changes within context and culture, because period poverty is something that you can transition into and you can transition out of. We need to be reacting to that continuum. We need to be focusing on environmental changes, and we need to be responsive. We must call for menstrual health to be included in global health security appropriately and properly, not in a tokenistic fashion. And we need to remember that together we are trying to eliminate period poverty and promote menstrual health. We cannot lose sight of this during this pandemic and our efforts to build back better, stronger, smarter and fairer. Periods don't pause for pandemics. We have a responsibility to ensure that they don't hamper the efforts of our healthcare workers, our caregivers, our social workers, or any individual that is menstruating during this pandemic. All individuals that menstruate have a right to menstrual health, and together as a movement, as all of us here today, we need to address period poverty, support menstrual health, to support health for all. Menstrual health is a right even during a pandemic. Thank you so much, Pavita.
Thank you so much, Jenny. So we'll now be moving on to the panel portion of our discussion. Our panelists today are Janaina Irada of Plan International, Dr. Rajni Vadua of Plan India, Claire Hunt of Homeless Period Ireland, Diana Kasuku and Carolyn Griffith of Girls Health Ed, Karan Babbar of Pandemic Periods India, and Dr. Tana Wulji of World Health Organization Academy. So our first panelist is Janaina Irada. So Jenna, can you tell us about how you have educated donors to encourage them to fund menstrual health initiatives, particularly in emergency contexts?
Yeah, sure. Thanks, Pavita, and nice to meet you all. I think it's a challenge, especially when you talk about priorities in emergency. Now, more and more, you're seeing that menstrual health management is becoming an important topic for interventions in emergency context. But I think we still have a lot to do in advance. It's not only about delivering menstrual health kits or again to kids. It's a more integral approach, and I think it's also understand what is the specific needs of the population in that emergency context. I remember one of my colleagues once mentioned me there was a project where they deliver pads as part of the kits, and when they went to the evaluation, the monitoring evaluation, they found the population was used the pads to fix the bags of the children or fix the roofs. So clearly there was no assessment on what the women would like to have to manage their period. So I think this is just a clear example, like the importance of have this assessment and close communication with the girls, adolescents, and women before you take a decision on an intervention. I will pick up on something that also Dr. Flavia mentioned, that is the intersectoral approach. I think this is the key way of convincing donors to put money on the promotion of menstrual health. In our case, I work with the Venezuelan crisis in Latin America, and we did have two components on WASH, which is water, sanitation, hygiene, and education emergency. So how we convince that we need to invest part of this money on menstrual health is like, look, it's an intersectoral approach. So in order to have like adequate sanitation structures, we have to look at that from the women perspective and their needs, including which kind of space or sanitation space is the more adequate for them to do their manage their menstruation, and also from an education perspective, because many times we do fix the bathrooms, we provide water, and then we deliver the kits. But then again, the kits, if you only deliver the pads, the conventional pads that we use, they're not reusable pads. Once you finish the intervention, what these girls, adolescents, women are gonna do? They're not gonna have the resources to. So I think it's also time for the emergency sector look at menstrual health management, if they call like that, or in menstrual health. More sustainable ways. So, for example, the use of menstrual cups or the use of reusable pads. How can that be incorporated as part of the local economy as well? Because there are examples of how that be incorporated as the local economy. So I think this is the best way of convincing donors to put money on it, is through an intersectoral approach. And when you have the argument of rights, which Dr. Flavia mentioned, that, well, if you don't guarantee the girls have the adequate infrastructure, the resources, and also the education around it, it's very difficult for them also to be able to access education, especially. So this is one way I think it's a good way to convince donors to invest more in menstrual health.
Excellent. And so my second question for you is, can you tell us about what challenges you faced when introducing menstrual cups in Latin America?
I think that the main challenge, and I don't think it's just in Latin America, is the taboo related to the hymen. So this idea of virginity that many countries, especially depending on the religion, it can be a huge taboo. So there is a need of working not only, if you're going to pilot the menstrual cup, first you need to ask the people if they want to be part of this pilot. A way of doing that is first having a session where you explain what is the menstrual cup, where you talk about menstruation, you educated people about it, and that they can take decisions, the adolescents or the women, they want to be part of it and understand, because menstrual cup has this line of if you have to provide support, because the first months is when normally adolescents and women drop out, stop using it. And also you have to guarantee this women and girls, they have access to the minimum to be able to clean their menstrual cups. you know. So I think that all these components are very important. And even though you work with them, you have to work with the community, because the community talks a lot. So when they start talking about like, oh, there are this adolescent who's a menstrual cup, oh, she's not a virgin anymore, you know, a lot is related to that. So you have to work with the community, educate the community about it, so the girl doesn't feel the pressure of if I'm fine using it, but I'm not fine with what my community is thinking about me using it. So this is the importance of working with the local community, with maybe the caregiver who are in charge of this adolescent, and with the adolescent themselves, for them to understand and deconstruct these ideas. And it's not easy, but it's a work we need to do if we want to incorporate more sustainable options, especially in contexts where they don't have access to much water.
Thank you. Completely agree with you. And for all of the attendees, I just wanted to note that Jana in the chat function included some details about an event following this event that I think will be of interest to many of you. So please feel free to check that out. Our next panelist is Dr. Rajni Vadva from Plan India. So Dr. Rajni, can you tell us about your work with school-going adolescents?
Thank you for having me here, and I'm truly delighted to share my experiences and learnings. We all know millions of adults and girls still face significant barriers to comfortable and dignified experience with menstrual hygiene management. Sorry about this. So fear, shame, social taboos, ignorant, unsupportive teachers, lack of water, sanitation, disposal facilities, and lack of privacy act as barriers in building an enabling environment for safe and hygienic menstrual practices within the school premises. Through our programs, we have demonstrated multi-layered approaches towards addressing menstrual health and hygiene, keeping adolescent girls and young women in the center of programs through a gender transformative process for engagement of boys, men, community leaders, government front lines, and officials for creating enabling environment. So if I were to highlight key approaches, first would be on skill building, where in partnership with girls and women, we co-created and implemented ways to challenge attitudes and practices that hold the girls back. And also focusing on augmentation of appropriate knowledge and skills of a range of stakeholders, like the lady school teachers, the school management committees, who would then feel free to talk openly about puberty, menstruation, girls' empowerment. We also worked around infrastructure upgrade of girl-friendly school toilets with separate boys and girls units, providing changing rooms, provision of dustbins, incinerators for disposal, soap, water, hooks, hand washing units for more comfort and privacy. Then through mass media community drives, we promoted girls' perspective by providing forum to adolescent girls to represent their thoughts on menstrual health and hygiene. We collaborated with the wash sanitation missions to create cadre that helped in launching of the campaign, and also building capacities of the front line as a cadre to interface with communities on right knowledge and messages around menstrual hygiene. Through capacity enhancements of the government front lines, we also strengthened the gender responsive MHM services to adults and girls and young women. And especially given the pandemic situation, we took to the digital mode through SMS drive, social media, WhatsApp groups, virtual platforms to reach out to the frontline workers and the adults and girls across the districts when the schools were closed. So this is a snapshot of some of our work on promoting menstrual health hygiene in the adults and girls. Thank you, Pavita.
That sounds like excellent work. So related to that, how do you think this work can help these adolescents stay in school and enter the workforce?
So the challenges faced by the girls around menstrual health and hygiene that I earlier mentioned not only negatively impacts their sexual and reproductive health outcomes, but also affects their enrollment and retention in the schools, their self-confidence, and their ability to make decisions and take actions for themselves. We found that the menstrual health and hygiene friendly interventions increased the enrollments and retention of the girls in the school. It also reduced the dropouts from the schools and absenteeism from the workforce, as the clean toilets, running water facilities, sanitary napkins were made available. In addition, by addressing the stigma and the taboo, as well as providing pain management for girls who are in their periods, promoted the girls' dignity and well-being in the school and their engagement in school activities and also out of school activities. So by increasing attendance and potentially decreasing or at least delaying the dropouts, these interventions did have long-term effects on the well-being of people who menstruate. For example, one additional year of education in low-income countries has in turn been correlated with an average increase in the income of 8 to 10% in long term. There is also growing evidence that shows that investing in menstrual health hygiene can positively benefit several areas across the women and girls' lives, such as the economic benefits, participation in education, empowerment, health, including mental health. And thus, MHH being in center of advancing gender equality as a whole. We also observed that the adolescents, young women trained on skills, gained knowledge, and were capable of decision-making, problem-solving, more creative and critical thinking, effective communication, self-awareness, and they were able to cope up with their emotions and stress in a much better way. In short, the MHM interventions in schools help the adolescent girls to complete their schooling with self-confidence and also ability to make decisions and take the actions for self. Also help them enter into the higher education and into skills trainings or workforce as empowered citizens. Thank you.
Thank you. So next we have Claire Hunt. Claire, in your experience as gender manager and founder of Homeless Period Ireland, why do you think people are worried about talking about period poverty?
First of all, thank you very much for having me here today. Thanks to Girls Health Ed and thanks to Jennifer as well. I think it's a strange one. I think for me personally, I first heard of period poverty myself when I watched the film I, Daniel Blake. It's a movie set in the UK, you know, and there was a girl on welfare, a single mom, and she got caught shoplifting, and inside her bag was a packet of pads. And much to my shame, period poverty was not something that I had even thought about before. And I think then I then started volunteering and I then created Homeless Period Ireland. But I think, you know, unless you're aware of that situation, it's just not something that people think about. And I think, you know, once you meet with women who are experiencing period poverty, or you speak to people who are working within that area, you know, in homeless services, in domestic abuse refuges, and then I think, you know, it hits home that this really, really is an issue. But thankfully now, you know, as Dr. Flavia mentioned before, people are tweeting about it, it's out there on social media, and yeah, it's just become a much more open conversation now, and people are much, much more aware of it.
Thank you. So relatedly, Homeless Period Ireland is a volunteer-led organization, and you recently partnered with Little Ireland to provide free products to those in need across Ireland. Can you tell us about this project?
Yeah, absolutely. So Homeless Period Ireland is 100% a grassroots initiative. I run it entirely voluntarily myself. I'm a stay-at-home mother and I have a team of volunteer drivers. So I take absolutely no funding. And the reason why I take no funding is because I absolutely believe there should be no need for Homeless Period Ireland. This simply should not exist. And my goal is always not to exist. I am waiting for the government to step up to the plate here and do what they're meant to do. So until then, until that happens, Little Ireland got in touch with me, and we basically worked together in a way that we felt we could, you know, put something together that would tackle the issue of period poverty in Ireland, but you know, also with dignity. It would be very, you know, easy for Lidl Ireland to just say to me, here's loads of products, distribute them. But we decided to make this an ongoing partnership. So basically what we did in Lidl Ireland, there's an app which people can download on their phone. And through this app, they can register for period products. So it's all very discreet, it's all very dignified. Somebody is doing their shopping, and at the cash register, much the same as you would if you were availing of another discount voucher, you just scan it on your phone. So it's all very discreet. So that was one area we felt we had, you know, taken care of. But also, obviously, you know, a lot of homeless people don't have access to phones, but actually in Ireland, some people do have access to smartphones because they're given phones so that they can, you know, get accommodation in the evening. That's how it's done here. People register for accommodation through our homeless networks by phone. But in order to cover people who may not have access to phones, we also partnered with the Simon Communities, who are a homeless organisation, and they're nationwide in Ireland. So this meant that anyone who didn't have access to the app, we are able to distribute products nationwide, and Lidl committed to making a bi-month or a quarterly donation, very large donation of products to the Simon Communities. And then separately, to make sure all angles are covered, they also then make a donation to me, to Homeless Period Ireland, and I can distribute that on a needs by basis to the frontline services that I service. So that's kind of it in a nutshell, but the reaction to it has been absolutely fantastic. You know, it got really good global support, and I think what's really, really good about it is that it shone a light on work that's being done on a grassroots level. And also, just one important thing that I kind of mentioned on just a little bit earlier, it is important to say that Lidl have said that, you know, they are doing this until our government step up to the plate, because that's what needs to happen.
Excellent. That is really cool. Really, really awesome work. Kudos to you for doing that.
Thank you.
And one of our attendees, I think Elizabeth Zambelis, said that in fact, tech, chatbots, Messenger, WhatsApp, SMS could be really useful tools for the work we're doing during the pandemic. So
yeah, I think so.
Yeah.
I think so.
Awesome.
Thank you.
Yeah, thank you. So our next speaker is my colleague, Diana Kasuku, who's the Kenya Program Coordinator at Girls Health Ed. So Diana, you're a grassroots educator and you work directly with girls. Tell us more about period poverty in your context and what your role is as an educator. Diana, you're on mute.
Thank you, Pavita, for that speech. Okay, fine. Hi, everyone. My name is Diana. I'm the Kenyan coordinator for Girls Health Ed. I've worked with girls at the grassroots level, mostly in the slum areas in Kenya. And so many girls are facing challenges during their menstruation periods. And poverty is one key thing that ensures that girls in Kenya don't get the menstrual equity. So many girls fail to get the menstrual pads, menstrual health education. Reason being that they don't have access to these things, you know, and most families can't even afford to buy for their girls these menstrual pads. Most families prefer to buy food instead of buying for them the sanitary towels. So even during the last pandemic, it was even worse because of the curfews, the curfew hours, the lockdowns, and most of girls in the rural areas, they have to travel a long way in order for them to get these pads. So most of them engage in transactional sex with we call them boda people, but these are motorbike riders who offer transport to people. So they offer sex in order for them to get the menstrual periods, of which most of the times, if they're given money, they don't even buy those pads. Instead, they buy food for their families. Most mothers have subjected their girls, their kids, to get sex in order to provide for the family, in order for them to get even that pads, which is so horrible. It's so terrible. You get, and then there's something that I normally call it the myths and misconceptions that surrounds menstrual health. when a girl starts her periods, she's taken as being ripe for marriage, being ripe to be taken out. More so in communities like the Maasais, in Garissa, we have the Rendiles, the Boranas, So once a girl starts her periods, regardless of the age, whether you are 8 years, 10 years, 13 years, 15 years, you are ripe for marriage and they'll get you a man. And so most girls will drop out of school in order to get married. So, and then another thing, talking about menstrual health is a taboo. Yeah, speakers before me had mentioned that. In Kenya, most communities, talking about menstrual health is a taboo. So most girls don't feel free to talk about their body, about menstrual health, about periods, whatever they're facing, the pains, cramps. So only 50% of the girls are so free to talk about whatever they are experiencing with their friends. And that is with their friends, not even with their parents or older people or even health providers. And this 50% is in the urban areas. In the rural areas, it's even worse, yeah? And during this time, when girls are undergoing their menstrual period, some of them don't go to school because they can't afford this. They can't afford the pads or, So most of them use leaves. Most of them they stay in the sand in order for the sand to suck the blood. And that is first in Garissa. Garissa County is a place in Kenya. The semi-arid areas, yeah, where you might have the money, but the product is not there on time. And then during this pandemic, there was a problem because there were lockdowns, there were curfews. So you can imagine you've been locked down in a house. You can't go out because if you go out, the shops are closed. So you can't access these sanitary towels. And then even the movements were cut off. So getting these products in the shops, in the nearby shops, was a problem. Another thing I want to talk about is the Menstrual Health Bill that was passed by the Kenyan Parliament in 2017. Yeah, this was the Kenyan Parliament passed that all girls in government schools should get free sanitary towels. And we have like 3.7 million girls in Kenya who are to benefit from this policy. But the target wasn't met, yeah? Because in 2017, they reached 2.3 million girls. That is the year between 2017 and 2018. And then in 2018, 2019, they got 4.2 million girls. No, yeah, the target was 4.2 million girls, of which they didn't even hit that target. Why? Because challenges that the Kenyan government faced was finance. There's a lot of bureaucracy that surrounds these policies. So in order for the pads to be bought, there are so many people that have to put their signatures in order for it to be passed and in order for it to qualify. So that hindered these the sanitary towels being produced. So the target of 4.2 million wasn't met because of that. Okay, the government was to take care of 90% of the girls, and then the 10% was left for the non-government organization. Yeah, and then come last year when the pandemic happened, all this stopped. All this stopped because the schools were closed, there were lockdowns, there were curfews. So following up and ensuring that these girls got those sanitary towels was an issue. So and the schools opened this year, of which that they haven't picked up because the parliament right now is on a recess. And again, as I've told you, all this is being derailed by funding, because there's so many people and bureaucracy. There's so many people who have to sign in order for it to be approved, and the delivery has to be done. So until now, so many girls are still suffering to do that. Thank you, Pavita.
Thank you so much, Diana. And I can certainly vouch for all of the great work you've been doing. And thank you so much for talking about the policy as well. So next up, we have Carolyn Griffith, who is a teaching fellow with Girls Health Ed here in the US. Carolyn, my first question for you is that some people would say that high-income countries shouldn't have a problem with access to education around menstruation. in your work with Girls Health Ed and in general, what have your experiences been with access to education for adolescents?
Thank you, Pavita. So my experiences have been quite eye-opening. Part of the problem, I feel, begins with exactly that misconception, right? That wealthier countries don't experience deficiencies. The problem is really mostly revolved around underserved areas. So areas where mostly children are going to be overlooked. And although I somewhat knew the lack in these areas, my exposure to those targeted areas working as a teaching fellow with Girls Health Ed has really opened my eyes to how exasperated this problem really is. You know, hearing the questions that are asked, you know, during those sessions, those workshops, and seeing those aha moments, right, in their faces, it's priceless, but it's also concerning because, you know, especially within that age range that we deal with, you would expect that education is definitely there. You know, it's such a small population of girls that we deal with specifically. So education is really going to be comprehensive. It needs to be comprehensive. It helps them to make safe choices, you know, develop healthy and supportive relationships involving, you know, everyone from friends to family, and really about learning life skills. And these are matters and things that they're going to carry with them for the rest of their lives. It's really all foundational.
I completely agree with you, Carolyn. So relatedly, what challenges have you faced in your work that you think are unique to the US?
Well, the challenges in the US aren't as unique as most people are led to believe, right? One problem is that there's a common assumption that here in the US, each and every person has access to proper medical care and access to endless and unlimited, you know, sanitation supplies and products. But we know that couldn't be furthest from the truth, to be honest. You know, mainly because of diversity and differences that can be as subtle as crossing from one street to the next in some states, right, here in the US. You know, a developed country like the US, the inequities it's on a national level, right? You know, things from education, products, all those things should be affordable and available to everyone, but you know, it's not found in a lot of these underserved areas of the country. You know, a combination of the challenges that range from, you know, the taboo, I know someone mentioned this, you know, taboo associated with menstruation, to like social and living conditions, to poverty, which circles around, again, the lack of resources that we've all been talking about today, lack of education, lack of the feminine hygiene products. And again, all these things impact their quality of life. So it's not necessarily unique just to the United States. It's a global problem, right? You know, my thoughts are also that, you know, the same way that some of these other countries are recently making decisions and policy changes to make period products and feminine hygiene products free for all that are in need, same needs to be done in the US.
Thank you so much, Carolyn. And thank you for all that you do for Girls Health Ed, both you and Diana. I also want to note that Carolyn was in charge of all of our behind the scenes tech work for this event. So I want to give an extra special shout out to you, Carolyn. Our next panelist is Karan Babbar, a pandemic periods correspondent in India. So Karan, my first question for you is what have been the menstrual health experiences of girls and women in India, particularly during the COVID-19 pandemic?
Thanks, Pavita. So I know a lot of people have talked about very negative things when it comes to COVID-19 lockdown. So I'll start with the positive thing and then we'll move to negatives when I have a list. So as our conversation is moving around disposable menstruation, a lot of women are still hesitant to talk about or to use menstrual cups, like Janina and other panelists have already highlighted, and same is the situation in India as well. However, due to COVID-19 lockdown, there were a lot of women who found certain time where they can switch to menstrual cups since they had to stay at home, and they found that perfect, suitable environment where they could do that. So that was one thing that has been done, although it's done for a very, very small percentage of women. Around 2% of the women in my sample had switched to menstrual cups during the COVID-19 lockdown, but I feel that's a big achievement. Now coming to the negatives or to the bad part, as we all know. So across the world, there was there were certain limitations in terms of accessing the sanitary items, and so was the case in India. However, this particular thing led to a lot of black marketing. So there were women who had to pay 4 to 5 times of the amount of sanitary pads that they prefer buying, just because of the lockdown, since the situation was a little hesitant, the situation was a little bad, and that was something that has directly affected the girls and women in India. Other than that, there was really poor menstrual health, as Dr. Flavia and Dr. And Jenny has already talked about. Stress and anxiety increment in the women due to the secondary impacts of the COVID-19 pandemic. So the same thing has happened in India as well, since there was a lot of gender-based violence, and we already come with a lot of gender inequality in India. So the stress and anxiety levels could be seen in the Indian women, and that directly impacted their menstrual health. As I can see, 23% of the women in India, at least in my sample, they had missed their periods, and 15% of the girls in my sample had 2 periods within the same month. So that has directly impacted the menstrual health. Other than that, there were inadequate wash facilities, which are a common thing in India. Around 1/4 of my sample had inadequate wash facilities, which led them not to use menstruation in the best way or in the most appropriate way. And lastly, the taboos and myths are a part of menstruation across the low and middle income countries, and so was the case in India, where due to existing taboos and myths, it was difficult for girls to manage their menstrual needs properly. That's it.
Thank you. My next question relates to men and boys. So why do you think it's important to educate boys, men, and other people who don't menstruate about menstrual health, both in India and overall?
Right. So one of the main concerns that we have been talking in this particular panel intervention as well, that we don't get a lot of funding for menstruation, because that is not something that we talk about. So what do we generally talk about? We talk about things which concerns men, and since menstruation doesn't concern men, we rarely talk about it, or we broadly don't talk about it. And hence it's very important that because of this thing only, we need to talk about menstruation. Definitely it involves men and boys in the family, and if you educate them, it would be very easy for women to to manage their menstrual needs properly. What we see is a lot of women lack social support, which is a very important concern when we talk about menstruation, because most of the conversation has been only around the environmental impact. However, we generally don't talk about the socio-cultural aspects of menstruation, which is one of the very, very important factors. And I guess that is something what we need to bring in. So now coming to the main question, do we really educate men and boys in India? No, we don't. Definitely in books, there is a chapter, but across the world, we know, especially in low and middle income countries, that menstruation is one thing that girls are not talked about. And even if specifically we talk about menstruation, it generally comes in 8th class. However, in India, we are seeing that the average age is getting down. Even now, we call adolescence as 10 to 19, and it doesn't start from 13 and 14. However, the same things are not reflected within the syllabus. So I guess these are very important things that we need to talk about when we talk about educating men. Lastly, a very important point, since we have talked about males and females, women and girls, however, we always neglect trans and non-binary people, which are also a very important part of menstruation. So I guess it's time that we also start talking about trans and non-binary people, and we start including them in menstruation cycle. That's it.
Excellent. I love that. I love that. And I completely agree with you, Karan. So thank you for your insights. Our final panelist is Dr. Tana Wilji, who's the team lead at World Health Organization Academy. So Dr. Tana, my first question for you is, why do you think it's important that global health institutions embrace menstrual health in the workplace and advocate for menstrual health for the global workforce?
Great, thanks so much, Pavita, and I'm really enjoying this panel. I am home with my 3-year-old who has a fever, so she may chime in as well occasionally. But I really do think that we need to reflect back on ourselves as we look at menstrual health. As we've discussed, it's throughout the life course. It's not just an issue for girls and adolescents, but also if we think about the goal actually to push for gender transformative change, to attain gender equity, this is also about labor participation. And in the health sector, as has already been said, 70% of the workforce are indeed women. So that gives us 95 million reasons to get this right. What about ourselves? Are we walking the talk? As you're thinking about your workplaces, do you actually have an issue around how menstrual health is supported? And this may be a question we've not really even reflected upon. I know that at the WHO, it's something we've been trying to improve, because in fact, we do have a gap here. And when we started to raise this question in 2019, this question was actually met with some shock and almost some surprise. And I think it highlights that we actually need to normalize menstrual health at the workplace, and to support education, understanding of what are the employers' roles and how they can actually provide a duty of care to the employees so that they can manage their menstrual health with dignity at the workplace, especially in a sector which is so very much led and driven by women. We have to be able to get this right ourselves. So global health institutions really have a responsibility to model that. In the process of doing so, I think owning that change as a badge of pride, with a badge of pride, and not with a sense of shame, not just sort of look at it to say, well, how would that look if we did that, but really think about, well, how isn't it about time that we actually put this in place and we actually start to recognize this, that this is the baseline, this is fundamental to really ensuring greater agency and voice to these issues. I think the other thing that's important is not to see that this competes with any other issue around gender equity at the workforce. It's complementary to, it's additive to, it's supporting, it's not taking away air or space from those broad discussions, and minimizing it actually does the overall agenda around gender equity in the workplace harm than good.
Awesome. So yeah, those are all really good points. So related to that, can you tell us about some of the common challenges that you've experienced implementing this approach in the workplace?
Absolutely. I've been trying to work on this for the last 4 years, and what I have observed, and I think what I've read from others and discussions with other colleagues, this is not just an issue within our agency, but actually across the UN family. If you go to any UN office, these sorts of issues are very common and perhaps not unique to the UN, but other global health institutions and even hospitals and healthcare facilities. So this is very much disregarded. I think it's neglected as an area. It's not seen as an issue that's on the agenda when you talk about staff health and wellness or staff rights, or issues that concern staff. There's misunderstandings, and perhaps management are not well informed about what that actually means for staff. There's a perception that it's solely the responsibility of the staff member themselves, that there is no responsibility on behalf of the employer to address these issues. And in that way, not providing a means by which, in many instances, women and those who menstruate feel that they can manage mental health with dignity. I don't know about you all, we haven't shared our personal experiences, but I can tell you, I have definitely chaired more than one sessions, caught by surprise with my period and really worried about leaking through my clothes on that day. And I know that I'm not the only one. So I think the challenge we face is minimizing it. It's not recognizing it as an issue to be addressed. When it is recognized, there are other priorities seen as being more important. It's seen to compete with other issues concerning gender equity in the workforce. And we also may not raise this kind of questioning to other issues and other supplies that are freely provided at the workplace. For example, here are some that are freely provided at many workplaces. Cutlery, disposable spoons, sugar, cups, etc. Even condoms are freely available at the workplace, but not, dignified disposals, not menstrual products, or spaces in which, people who menstruate can actually hygienically do so. So I think we are not recognizing the gender dimension of this, and in that way really puts us in a difficult position. But I think what would really help is if we talk about it and we actually attempt to take that journey together, embrace that as a goal, and not to see it as something that is peripheral to our efforts in gender equity at the work.
Fantastic. Thank you so much, Dr. Tana, and to your daughter for your contributions. And thank you to all of the panelists for such a rich discussion. And thank you, yeah, to all of the panelists and to all of the attendees. I'm monitoring the chat right now, and we have a lot of great contributions. So we have about 10 minutes right now for questions from the audience, and I see some of you have already written some questions. Unfortunately, we're probably not going to be able to get through all of the questions, but know that this is a conversation that's going to continue over many similar events. And you should also feel free to reach out to any of us and to the speakers after the event. And as I mentioned, we'll be sending a special newsletter with the recording after the event, so and the speaker bio, so you can reach out to them. But I'll just start by pulling some questions from the chat in the order in which I received them. So the first question I have is from Maisha Zaman. And your question, Maisha, is, it seems that all of the work here is being done by development organizations and not so much by governments. So first of all, why is this? And how can we encourage governments to address the social stigma? So I'll open it up to the panelists if anybody wants to chime in.
I will step in quickly, Pavita. As I'm gonna answer your question based on the experience we have in the region, right? What we have been finding out is there is a movement in some countries to start at least like offering pads available in schools, so guaranteeing the girls in the school context they have access to pads. But I think a broad law to get that guarantee as a human right and it's a basic need. It will depend a lot on data collection as well. Most of the policies will rely on taking decision, moving this decision forward with data. So like studies that shows how that being affecting women. I think this is something we have to move the agenda forward so we can actually show and ask as the politicians to look, this is a public health issue and we need to address that. So I think that would be the first step to actually start moving the agenda in a more public policy.
And maybe if I can come in also, Pavita, I think, as I said at the beginning, we need to see this in the context of gender equality. When you have a sample of leadership in health that comes to the World Health Organization Assembly that is 75% represented by men, these are not the issues that will come to their mind. And the colleague who spoke, the men were not educated on this topic. They see it as marginal. They see it at best as a distraction. They don't feel comfortable to talk about it. So I think one of the key reasons to have large international organizations like the World Health Organization and like the WHO Academy to speak about this is to educate the senior policymaker that this is an important aspect, because otherwise it will not be tackled. And I wanted to say, Tana, again, when you talked about what your experience, I had exactly the same experience as a senior leader within the World Health Organization when we were trying to advance, for example, the parental leave for women, when we were trying to advance the availability of a breastfeeding room, of facilities where a woman that has a child can exclusively breastfeed. So that's typical reaction by the organizations because they reflect inherent bias that all people leading them have. So I think you have to have the transformative leadership of those organizations that includes females that can lead and can see that this is a reality and a necessity.
Great. So the next question is, how do we implement programs? This is from Deepika Rana. How do we implement programs during a pandemic when schools are closed and gatherings are limited? So I know that there's been some conversation in the chat about digital tools and platforms, but if anyone would like to speak to how we can continue this kind of work during the pandemic using digital tools and educational tools.
If I may, you know, I think there are a lot of opportunities to use digital platforms to support education, especially as we see education, just like health, has been severely disrupted in the context of COVID-19. So there's definitely a case for that. I think we also need to think about, as we embark on that strategy, again, with the same line of normalizing this, not to create siloed channels, but really integrating this into existing platforms and channels that are being used so that you can get the widest outreach. And again, in this perspective, not marginalizing this conversation, but making it very much mainstream and normal. The other aspect I'd like to highlight here is that the digital maturity, if you look at the data around this, a lot of people are not going to be able to be reached. If you just take health workers alone, who are already in a privileged space compared to many others in the community and the public and have much greater digital access, only 3% of 90 million health workers that are digitally accessible live in low income countries. And so the settings in which where we see the greatest vulnerability to period poverty may be settings in which digital platforms may be very challenging as well. So we have to really think about mixed approaches, bringing this into all conversations, mainstreaming it, and not just doing a one approach, but indeed lots of potential there using new technology.
Janina?
Yeah, thank you. I'm so sorry.
Okay, in the meantime, maybe Carolyn or Diana, GHE has done a lot of work around digital education. Would either of you like to speak to the work that GHE does, or I can chime in there?
Hi, Pavita.
Yeah. Yeah, Diana, would you like to speak to that?
Okay. There's something that I left out about the key population, people who live with disability. You get in Kenya, accessing even the washroom is an issue. Yeah, already there's poverty, and then these people are disabled. So meaning they can't access this, they can't access the washrooms. So sanitation is also an issue. Street children, yeah, they can't even access the toilet, they don't have the product. So these are the key population that you should also look at. And it's one thing that I'm writing proposals to the government, to the parliament, so that at least they can take care of these key population, people living with HIV/AIDS, people living with, because people living with HIV/AIDS already, they have a problem to feed themselves. They have a problem to get the medicine. So getting these sanitary towels, getting this is an issue. And then people living with disabilities. Most places, not unless in the high end, is where you'll get toilets that have been created for people with disability. But in the low end, which covers a majority of Kenyans, even in the rural areas, they don't have these facilities. So that is one area that I wanted to share with you people that needs to be looked at. People living with disabilities, and then the street children, they're out there in the streets. They can't access the toilets because the county toilets, they have to pay like 10 shillings in order for them to get a tissue, in order for them to even go there and change. They can't even access water. So even if you give them reusable pads or even the disposable pads, they don't have anywhere to do. So that was the only contribution that I wanted to do. Thank you, Pavita.
Yeah, and I think you bring up an important point about the street children, because this is something you and I have discussed about how they don't have access to broadband, to WhatsApp, to digital technology tools, and that poses a real issue for us in implementing our work. But Carolyn, if you'd like to speak to the technology and digital aspect in the US context, I'd love to turn it over to you.
Yeah, so the transition, you know, specifically moving into this pandemic world that we've been in, you know, the need was still there for our girls to be able to get the information and get the instruction and the education that they so desperately desired. And again, that transition, you know, we all kind of went through it, being able to use technology to put that stuff in the forefront and still making all of this context really important and plausible for them. It was difficult. It was a difficult transition, and being able to continue that learning for the young ladies. You know, it was something that we all kind of had to work through that process to get to. But technology is definitely one of the aspects that we continue to use to reach these audiences.
Thank you so much for that, Carolyn. Before we move on, there is one important question that I would like to highlight, which is MHM, or menstrual health management, identified as a human right? And this is from Rana Shihabi. So would anybody like to address that question? Is MHM identified as a human right?
It's currently not. That is quite clear. It can be subsumed under the right to health, the highest standard of the attainable health and the right to health. It can be subsumed under that as a, a key element. But I think what needs to happen is that we need to be explicit about what are those dimensions that are missing. And we need to have a gender lens on those dimensions, as I have said at the beginning. And the other thing, in addition to our conversation and with the UN Women in the context of gender equality, I think when we use the human rights lens and the human rights approach, we need to look at the spaces where the human rights discussions happen around the Human Rights Council, and try to have, for example, inclusion and suggestions and maybe events and maybe discussion with the participants to those discussions. And you will find that the gender of the delegation that participate to those discussions, unfortunately, is not the gender balance is not much different from the one to the World Health Organization. So we are again having to raise these in the context of broad discussion of gender equality. But we are lucky because currently the High Commissioner for Human Rights is a wonderful woman, former president of Chile, Dr. Bachelet, that has a great understanding of the right to health and well-being of all individuals. So that's a good entry point to bring this up this year.
Thank you. And Karan, I know you wanted to say something as well.
Yeah, sure. So like I've talked about, there's a lack of social support. There are many taboos and myths. There are inadequate wash facilities. So this directly affects the menstrual needs. Now, since menstrual needs are affected, so it is affecting the chance of girls to go to school, college, workplaces, which directly impacts their rights to water and sanitation, health, education, work, non-discrimination, and gender inequality. And all these are sustainable development goals. Since we are not able to meet these things, like Dr. Flavia said, that it's not a human right now. But going forward, I believe it should be a human right because it's directly impacting the basic necessities what women are looking at.
Thank you so much, Karan. So I know that we have a ton of questions in the chat, and unfortunately we don't have time to get to all of them. But as I mentioned, this conversation will certainly continue, and you can reach out to the speakers at any time after this event. So with that, next up, we have a very special address on reframing the narrative around period poverty from Dr. Chandra Muli, who works on adolescent sexual and reproductive health at World Health Organization. And incidentally, Dr. Chandra also moderated a panel that both Janaina and I were on yesterday. So Dr. Chandra has worked with WHO for over 25 years. He's led or contributed substantially to a number of WHO publications, including evidence reviews, policy and programmatic guidance, advocacy documents, training, self-learning materials, and research and evaluation tools, and has traveled all around the world where he supported research studies and evaluations, and contributed to policies and programs in different social, cultural.
Let's move on to the subject.
Okay, Dr. Chandra, please.
Thank you. Just call me Chandra. Could I have the next slide, please? So Jenny asked me, hi, everyone. I've been listening for the last 45 minutes to the discussion. And what I'm going to address in this short presentation of 3 minutes is one of your questions about, is this a right? So I've been working in WHO for 25 years and on menstrual health for over the last 10 years. And that's because I work on adolescent sexual and reproductive health. And when working with adolescents and you ask adolescents what their needs are, menstrual health and menstruation experiences come up again and again. One of the workshops I've run around the world is when you start an adolescent health workshop, you ask people to think about one experience from their adolescence that they'll never forget. And you ask them to write it in a card, put it face down, and you cluster them. In every workshop around the world, you have an experience of one day I was in school, the girls behind me and the boys behind me were giggling, and then I saw that there was blood. I thought I was going to die. The teacher took me to the staff room and made me wait for my mother, who came after 3 hours, and she looked as if there'd been a death in the family. She brought a blanket, took me home, gave me a bath, and said, you can't go out and play with the boys. You know, those are the kinds of experiences. So for me, I saw that menstrual health was a very important part of the agenda. But in this presentation, I'm going to talk about this new definition, which we've just published with the Global Menstrual Health Collective's terminology group. And we define menstrual health aligned to the WHO definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in relation to the menstrual cycle. And this is a journal paper, which I'll put in the chat and you can have access to. The next slide, please. So what it says is that to achieve menstrual health, you need to have access to accurate, timely, and age-appropriate information, access and use of materials, facilities, and services, access to care for discomforts and disorders, growing up in a positive and respectful environment, free of stigma and psychological distress. I still remember a paper from Kenya, which I read many years ago, which said the girl who has a period hangs her head in shame. Growing up in India, I know that that was very much true in India as well. And from my work, I know it's a reality in so many parts of the world. And decide whether and how to participate in all spheres of life. Next, and the last slide on this. So why is this, no, the previous one, please. So why is this slide important? It's grounded in a definition of health. It addresses the entire menstrual cycle, that means before menarche and after menopause, across the life course. And it signals that this is a public health issue with several dimensions: physical, psychological, social, and it's not just about hygiene. So this is a departure from the term menstrual hygiene management. It sets out actions that need to be, hygiene is important, of course. I remember Tana saying that, you know, she was in a meeting and she was worried whether, some blood would leak. And so hygiene is important. Ability to manage your periods are important, but, you know, there are many other dimensions beyond that. Sets various actions within and outside the health sector, and acknowledges that while most people who experience menstrual cycle are women and girls, transgender and non-binary people may also experience menstrual cycles. The thing, you know, Flavia, hi Flavia, you know, I worked closely with Flavia, and, you know, Flavia talked about men and women. You know, I worked with, you know, when I was trying to move the agenda on menstrual health, our Director General was a woman, Margaret Chan. You know, I don't think it's necessary to be a man or a woman to recognize and move the agenda. I think you need gender open, gender sensitive, gender transformative people, and you can find them in both sexes, both genders. And you can, you know, many of the rules of inequitable gender norms are imposed by women who have been ingrained into the system. I know that's not a politically correct thing to do, but I think what we need is bridges across both the sexes and engagement with champions in both the sexes. That brings me to my last slide. We have been talking about menstrual health, but, you know, insults about menstruation and neglect of menstruation is grounded in insults and neglects of girls and women across a life course. With sex-selective abortion, that means killing them even before they come into the world, infanticide, with deprivation of food or medical care when they're ill as babies, marginalizing them from good schooling, and all the way to neglect during when they're elderly. So menstrual health and neglect of menstrual health is clearly one of the one of the issues in a big spectrum. I was in another webinar where I made one point, and that's my last point today. The World Bank estimates that many million people are going to go back into absolute poverty, and that most of the new poor are going to be in middle-income countries. When countries become poorer, there's less household income, and there's less household income controlled by women. And even if there is income, as one of the Kenyan participants said, that little income may, even the woman may say that, you know, menstrual health is not important, other things are more important, school fees are more important. The other issue is that aid agencies and governments will see this as less important. So I think the point made about bundling that Tana and others made is important. So this definition is a definition which places menstruation, the menstrual cycle, within the WHO definition. And in this event that took place, the coalition on African Coalition on Menstrual Health, Ian Askew, our director, announced that we'll set up work on menstrual health across the life course, which is great for people like me who've been pegging on with the focus only on adolescents. Thank you for the opportunity to contribute, and I'm sorry to have joined late.
No worries at all. Thank you so much, Chandra. So in closing, we have an address from Victoria Heaney, who's the founder of Free Period Scotland. And Vicky will be summarizing some of the key messages from this session and discuss next steps to improve access to menstrual health and education for all. Vicky.
Thank you, Pavita, and thank you to Jenny for enabling such a diverse global platform today. Like, I've truly enjoyed listening to everyone speaking, and I'm feeling very uplifted, and I'm feeling like there's a lot of power in the room today as well. So thank you. And I think it's also important today as well to just to remember that, you know, we need to make sure that menstrual health and period poverty stay on the global agenda, especially during the global pandemic too. And I think today, listening to everyone, it's been quite inspiring to think about the journey over the last few years. Over the last few years, we've watched how activism and grassroots movements bridge this gap between menstrual health and period poverty. It was quite a new approach that enabled rapid policy creation in Scotland, and that's in turn created a domino effect, which is already built in the other great works of other countries in the global south and in Kenya too. And I think that's been a tremendous case study in how having your feminist networks embedded into politics, embedded into your communities, it has a huge advantage points in actually progressing our agendas that we're talking about today. While there's been lots of huge inspirational work going on around the menstrual health and management space, I found over the years that it took a while to break into the public domain. You know, everyone was in their own bubbles working away. And what we've seen in the last few years has been a rapid culture shift in how we talk about and how we discuss periods. We are moving forward and we are progressing quicker than ever. So I think we need to take a moment as well to celebrate our gains and to celebrate our successes too, because we do always say we have more work to do, and we'll always have more work to do, but it's really, really positive to hold some space for, you know, the gains that we have made. I'm thinking that as practitioners, activists, researchers, academics and healthcare workers, before we engage in trying to create solutions, we need to clearly understand what are the problems that we're trying to solve. Jenna from Plan touched on a hugely important point. She was talking about how they were designing and delivering solutions and programs based on assumptions that didn't work for the communities that they were working in. And I think we need to take stock of that, because we can only truly understand the complexities of period poverty and menstrual health management by adopting user-centred design approaches and methods. And what this really means is, it means we need to take the women, the girls, the people that menstruate on the same journey with us, from the inception to the design to the delivery of these approaches and these programs that we all work in. And when I say that, I mean especially our trans and non-binary communities too. So what have we learned so far, and where are we going next? I think today what's came out of all the discussions is that we need to keep listening to our communities. And a big thing that's really shining through for me today, it's about the language that we're using. Yes, it's totally fantastic that we have definitions for, you know, menstrual health. Who decides on this language? Do these definitions work? And does this language trickle down and empower the women and the girls that we are all working for, or does it also create other barriers too? I really believe that we also need to think about, our privilege and how we have to be open to be adjusting our approaches around the language we use and the assumptions that we make around what women and girls need. I think, the period poverty, menstrual health space has become very, very busy over the past few years. And I think it's always important that we take a moment to pause and reflect and adjust, does our scope still fit the needs of the communities that we want to serve? I think today there's lots of lessons we need to learn about the progress that we've made. And I think we need to also maybe start looking back to learn about those lessons too. What have been the critical success factors that have led us to where we are now? Can we identify how these successful strategies, and I'm giving a nod to Scotland here, and how this worked, and what can we learn and how can we build on in those spaces too? I think my biggest takeaway from today has been that around language and how words matter, and it's who are using these words. I know that we're seeking to professionalise a lot of terms, but we also need to think, who are we professionalising these terms for? For us, for the women we're working for. I really do find that over my last few years of being in these spaces, we still tend to use a lot of inaccessible academic language, and it doesn't trickle down into the communities. And that onus is on us today to pause and reflect and change our approach. So moving on, how do we create this next generation of leaders? Well, period poverty and barriers to menstrual health will only continue to be progressed if we are able to normalise these discussions around periods. And that starts at the kitchen table. It's in our schools and it's in our workplaces, but it's making sure that those conversations continue to stay in our parliaments, councils, and all the institutions of power that we operate in. And I think today everyone in this space is excellent at contributing towards this. Everyone is, helping towards these causes. But we need to do more, and it does start with the language. It's 2021. I was going to say it's bloody 2021, but that's quite cheesy. But we're still using words such as hygiene, sanitary, and other stigmatising language. I know that the word menstruator can be so divisive too. We need to find ways to be inclusive, but to give dignity and respect to everyone. So I think today, with everyone that is in this space, we need to really commit and pledge to do something. We need to use our power and change the language that we're using. So maybe next year we're not going to have Menstrual Hygiene Day. Maybe next year we'll have Menstrual Health Day. And I think there's enough of us in this space to use our networks, open up those conversations and make that change happen. I think the last thing that I want to say is that we need to make sure that we ground our approaches in recognising that poverty is our #1 barrier. It's only when we address this that we will set the menstrual health agenda and deliver for all women, girls and people that menstruate. The gains that we see today around legislative process to address period poverty was led by working class women, and the period poverty movement in Scotland was built on the back of women with real lived in experience of poverty. Their lived in experience is shown through, and that's what enabled our legislators to progress to the period poverty bill that we have now. So I just wanted to say, let's ensure that we continue to centre and amplify the voices and experience of women, girls, trans and non-binary people who menstruate. And thank you so much for creating a space for me today.
Thank you very much, Vicky. And what a beautiful way to end. And yeah, just for the record, I have been calling it Menstrual Health Day from the beginning. Yeah. Absolutely. So that's a great way to wrap up today's conversation. And we did quite well on time. So kudos to all of the speakers. As I mentioned earlier, this is just one of many conversations, and we look forward to seeing all of you at many more and continuing to work together to make progress on this most important issue. So please feel free to reach out to us anytime. Please share about this event on your social media. As I mentioned, we'll be sending the recording and the speaker bios, and you're welcome to reach out to discuss anything of interest. So thank you again for coming. Happy Menstrual Health Day, and have a great rest of the day.
Thank you, Pavita.
Thank you.
Thank
everyone.
you.
Thank you.
Thank you, Pavita.
Thank you so much. Great to see you again.
I didn't want you to read out a long